Thanks everybody for your time. I'm going to talk a little bit about a digital transformation plan, but I'm going to really start with the things that are here and now and will impact on you in the next sort of 6 to 12 months, and then we'll end with a little bit about the bigger picture. You're right, it is wobbly, this, isn't it? So I'm going to talk about new cows, PC refresh, Microsoft Office 365, a little bit about some stuff we're doing just now with Cerner, and a little bit about digital communication, and then we'll wrap that up with the big plan at the end. So cows, in November, the board approved us to go to a model of leasing cows, and we have been working, Teo in our team has been working with nursing and doctor representatives to go through, make sure we've got the requirements right. We went out to the market in April. The tender closed on the 2nd of May, and we're just evaluating that. So in the next 6 months, roughly, we are aiming to roll out an entire new fleet of cows across the entire hospital. So about 350 devices. That's good. What's even better is we're leasing it. So these things will be on a 3 or 4 year lease. And that means at the end of that period, they'll all just get swapped out and replaced with a new one. So we won't be sitting here in 9 years with 9-year-old cows that don't work and can't be cleaned, and all of those sorts of problems that you face all the time. In the design of these cows, working with the clinical teams, we've come up with something that has an electronic lift and lower, so that's better ergonomics, a little bit better weight distribution for maneuverability and anti-tipping. The power will obviously last the shift, so you don't have to plug it in the corner all day. A larger monitor, and as I said, a fully maintained lease, so that at the end they just get swapped out, and if there's any problems, it'll be back on the person, the supplier, to fix that for us. In a similar vein and in the same moment, the board gave us approval to go to leasing our PCs. So we have 5,500 PCs across the hospital, and more than half of them are more than 5 years old. We have devices that you have to use that are 9 or 10 years old. So again, we're going to move to a lease model. That means the cost of these things is effectively built into the business. It'll take us a bit longer, it's a much bigger project, but within 4 years we should have refreshed all of the PCs around the hospital, and from then on they just roll through, and in the long term nothing will ever be more than 4 years old. When it gets to the end of the 4 years, it'll just be flipped out and replaced with a new one. And that will have a real impact to all of you, because some of the performance issues you see are just because it's a very, very old machine that you're working on. As part of that, we will start with all of the 3,500 Windows 7 devices that are out there. Windows 7 is a Microsoft version of operating system. It's out of support January next year. After that, it becomes a security risk, so we need to crack on and get those out of the environment anyway. And we need to get rid of Windows 7 and replace it with Windows 10 because we want to move to Office 365. So there's a couple of technical reasons to do that, but the main reason is just to give you all devices that work. And included in that is we've done a bit of a review of what, does everybody need a PC? Some people might be better with a mobile device, a Surface Pro or a Surface Go or something like that. So the lease will be more flexible in terms of what we can actually provide to people. And then in April, so Microsoft products, Word, Office, Excel, email, all that sort of stuff. We have an enterprise agreement. It renews every 3 years. We've just been given approval to renew the next 3-year one, which is a move to Office 365, which is all modern subscription-based and cloud-based tools. So that's okay. But there's some real value add for all of you in a move to a modern workplace. So I'm just going to give you some screenshots now of what we're looking at and talk to you about the differences that this will make. Starting with, as a foundational piece for this, we need to upgrade the hub to a SharePoint site. So before we can do anything else, we've got to get onto a modern SharePoint site. So the hub will become, will be re-implemented in a design that works for the hospital. The design isn't my remit, but at the very least it will allow you to have department-based websites, intranet sites if you like, that are only visible to you as a department and don't have to be visible to the whole hospital. And we'll also migrate Epic into a SharePoint site, which means you'll be able to have control over your policies, and if you search for a policy, you'll get the current policy, not the one that's been looked at most often, and a little bit better document management control so people can have more control over the writing and versioning of documents. So that's a bit of good sort of housekeeping that is necessary. But the main thing I want to talk about is the better collaboration, and then a little bit about security and control of data. So Microsoft Teams is a collaboration tool. This is a desktop view of that tool, and it's effectively a bunch of files, is what it looks like with documents in it, a bit like a file share. However, this is a team that we just set up for the IT leadership group to go and explore. And then the same tool is available as a mobile app. So that's what it looks like on an Apple phone, and that little red dot up there tells me that I've got some sort of message in Teams. That's the same folder structure that we just looked at, but now on a mobile device. It can be used for secure chat, and you can send all sorts of things in that secure chat, links, documents, messages, whatever you want. Now again, this is something that you actually do, or the hospital does, people in the hospital do, using all sorts of different applications that are not necessarily managed in our environment. The information may not sit within our environment, so it's not secure the way it's happening at the moment. This will give you the capability to do what you want to do and what you're currently doing, but in a secure way that protects our data. So those chats can be one-to-one or one-to-many. So for instance, one use case that I know is the senior medical staff don't have an easy way to communicate with each other. Well, you can have a senior medical staff group, and if you send a chat, it will go to all of those senior medical staff, and it will pop up on their phones with that little red dot. So it's really enabling a lot of communication capability that we don't have at the moment. And this tool can be used to initiate video conferencing straight off your desktop or off your phone, and it can be one-to-one or one-to-many. So in this instance, I send a chat to Ralph if you've got 5 minutes to look at the audit. You then click on the video conference button, and away you go. There's Ralph sitting in his office, and there's the screen, the spreadsheet that's been shared from his desktop straight back to me, and we can work on it together. So there are many ways that this will liberate all of you in some of the administrative tasks that I know happen right now with spreadsheets that are offline, and you can't, one person can get into it at a time, and you can't update, and you want to share it, and then nobody can share it, and all this sort of stuff. So all of that goes away when we get this tool in place, okay? It's also integrated with your Outlook calendar, so meetings just pop into here. This is a, let me just check. Yeah, cool. So this is an innovative Microsoft product, I would say. It's not new, it's been around for 2 years, but it's not universally used. There's a lot of organizations in the world are not using Teams. It's really the direction that Microsoft decided they want to go in the way they help people to collaborate. And I think this is an important point. Part of our strategy and vision for this hospital is about being bold. There's many health agencies had to go through a Microsoft Enterprise Agreement at the moment. We're the only one of two who have really embraced this vision, and a lot are going, don't really want that, it's a bit scary and we're not sure what the value is, and we've gone, well, the cost is there, we've got to invest in this, so how do we get value out of it and how do we use it to make all of your working lives better? Microsoft are very excited about this, to have a couple of hospitals who really understand the value in their product, and I suspect that in 18 months' time, there'll be case studies written about Austin, about the way we work within Microsoft's Teams environment, because it really is going to facilitate your a lot of the communication and collaboration that's really hard to do at the moment without this sort of tool. Where are we up to? We've done a couple of proof of concepts just to make sure we know what we're dealing with before we got to signing any contracts. It's a constantly evolving tool, so there's a lot of training and education and change management needs to go at this. The technical change isn't really too hard, but in terms of the education and training, I think that's where the effort needs to go. And I think the most important thing to kind of grasp about this is that once it's done, everything builds off our organizational structure. So there's a concept in here that if you want to speak to the orthopedic registrar, you won't actually need to know who the orthopedic registrar is, because you can send the chat to the orthopedic registrar. And whoever it is in the group and gets the message. So you can either do person-to-person communication or you can do role-to-role communication, which again is an important thing for an organization as complex as this one. Cerner, the Progression of Care Board, name has changed since yesterday. This is a ward-based tool that we've been working with the clinical people to put together. Lynn's team have done this, and it's designed to give people on the ward, well, it's an electronic version of the whiteboards that already exist. You know, what's the status of a patient on their progression of care and in terms of getting them ready to go home or go to another facility. It's all integrated with Cerner, so as you put an order in or as you put a result comes back, then the status will update. That's ready to be trialed on one of the wards in the next couple of months. So that's just a bit of visibility of that. The emergency department board is a real-time update on the status of the emergency department, how many patients in their waiting room, how many in the cubicles, who's waiting for a bed, how long have they been waiting to see a doctor, all of that sort of stuff. And that is live now, Lynn, as of last week, is it? This morning, right, cool. Digital channels, this is the idea of a portal or an app. It's really about how we communicate electronically with patients, GPs, other hospitals, all of that sort of stuff. It's a big, complex space. We're doing a lot of work at the moment with the specialist clinics team to look at how we can bring in the tools that allow us to manage that communication piece between receiving a referral, sending it to somebody to check the referral's complete, triaging it as urgent or not urgent, getting it booked in, and then at some later date communicating with the patient to make sure that they're actually coming in, and if they're going to cancel, giving them an easy way to cancel, and all those sorts of things. I think we've got massive opportunity to facilitate that and make it a bit more effective and get rid of some of the clinical risk. So at the moment we're just doing a bit of a solution architecture piece around that. Oh, wrong way. So those are all the immediate term things that we're working on. In terms of that overall strategy, there's two things I'll just bring your attention to. The first one is this, it's what we call the Cerner Closing the Gaps project. So part of the challenge all of you face is that we have Cerner in some parts of the hospital and not in others, and it's differently implemented. And so in the course of last year, we had some conversations with Cerner and with other hospitals, and the idea was what should we have? What's the complete level of implementation of Cerner that we need for it to make sense across the hospital? And so then we've put a business case together that we've put into the Department of Health. It's a $54 million project, which we're hopeful will get funded next year. Nothing's certain. but it really is around plugging all the gaps within Cerner. So it's complete doctor, nursing and allied health workflow and documentation, device integration, ICU and anesthetics into Cerner, decision support, specialist solutions for mental health and outpatient clinics, patient portal, mobility, so have Cerner available on mobile devices properly in a mobile format, not through a Citrix portal, appointment scheduling and PAS within Cerner. So it's a big piece of work, but if it's funded and we roll through it, it'll take about 3 years, and we'll get to a point where we've got rid of many of the bits of paper and interchange between systems that makes life really hard at the moment. If you want more information about that, it's on the hub in EMR and IT services, digital transformation. That little graphic is there. You can have a look through it. And then this is a summary of the overall transformation plan. So that graphic there that I just showed you speaks to this part, the electronic medical record plan. Digital channels, how we communicate with patients is in this part. Cows, desktops, Microsoft licensing is all in here in the technology fabric. And then we're also doing some work on how we engage as an IT department with the business, and a review of our corporate systems and how they may or may not be improved. So that's a summary graphic. There's, I think, 95 pages of documentation that sits with it. That's also on the hub. I'm very happy to take questions, or if you find a typo, let me know.